3, 2, 1. Please start.
Hi, this is Dr. Thanush Nakra from Gold Cosmetic Surgery. Over the last few years, Debraj and I are proud to have built an international network of unbelievable faculty and also a wide network of attendees that have enjoyed our numerous successful conferences. I learn as much as the attendees from these conferences, and I look forward to this one so much because we're going to be hearing from hair experts from around the world about modern techniques for hair rejuvenation that are going to enhance the lives of people around the world. So, thank you for joining us today. We're incredibly excited to have you be a part of this Hair Talks event, and let's let the show begin.
Thank you, everyone. This is Dr. Debraj Shom, and I'm from the Global Cosmetic Surgery. The Global Cosmetic Surgery was an aggregation of the best aesthetic minds, as you all are aware, which was set up in 2020 when COVID played a major role for all of us trying to use the web platform to bring people together. Education is important, and not everyone may have access to the best minds in the world. And therefore, what Global Cosmetic Surgery wants to do is to get the best dermatologists, plastic surgeons, cosmetic surgeons, and various other specialties on one platform so that we can discuss things which help us improve our practice and thereby improve the lot of our patients who may be in different parts of the world. This is the 8th event by Global Cosmetic Surgery, and our events have been incredibly well received all through the globe and have been received and have had more than 3,500 delegates on an average for our larger meetings and approximately about 1,000 delegates for our smaller meetings, all through these last 8 events. Usually, there are people from a global aggregate of countries which attend these meetings. Today also, there have been about 700 plus registrations, I'm told, and these are from 20 plus countries at this moment in time. So thank you, everyone, wherever in the world you may be, whether it is good day, good afternoon, or good morning. Thank you for joining in, and thank you for spending another evening with us to listen to this wonderful aggregation of stellar faculty that we have today. Today's Hair Talks is going to be talking about the QR678, and a general introduction to the speakers is in order. So our first speaker will be Dr. Rinki Kapoor, who's the director of the aesthetic clinics, and she will be talking on QR678 versus PRP. Before she gets onto the dais, Dr. Vaibhav Kumar, who's the product manager of the sponsor of today's talks, QR678, will be speaking more about the QR678 Neo. After that, we have Dr. Neha Sajde. Dr. Neha Sajde is the director of a chain of clinics called Metamorphosis, with a lot of its centers in Mumbai and Delhi, who will be talking on the use of QR678 in telogen effluvium. Post that, we will have Dr. Miki Singh, who will be joining in and who will be speaking about, she's the director of Bodycraft Clinics, and she will be joining in from Bangalore, and she'll be speaking about hair rejuvenation and the use of QR678 for the same. After that, one of my favorites, Dr. Simal Soin, who is the director of Aina Clinics, which a chain of centers in North India, will be speaking of her experience of using the QR678 at Aina. Dr. Bhairavi Senthil has let us know that she is suffering from a family exigency at this moment in time. So I don't know whether she'll be able to join in because her father-in-law is in hospital at this moment. But nonetheless, she's the director of Skin Health Foundation and a very respected cosmetic dermatologist from South India, from Chennai. And we do hope she'll be able to join in. And at the end, one of our important speakers, Dr. Deepa Prabhu, will join in from Johannesburg, and she'll talk of the experience of QR678 in South African patients. Our moderator of the show is Dr. Arundha Abrol, and she will be making sure that the panel discussion is led from there on. So let all the discussions begin. And it's over to Dr. Vaibhav Kumar, who will present the first 3 minutes talking about the QR678, which is the sponsor of today's Hair Talks. Thank you once again, everyone, for joining in, and look forward to an enthralling discussion.
A very warm evening to one and all present here. My name is Dr. Vaibhav Kumar, and it's my proud privilege to introduce the revolutionary QR678 product in the capacity of the product manager in front of you all. It's all about hair today, and the hair care market is booming as we speak. The QR678 is a proprietary first in class hair fall and hair regrowth therapy, which has indeed revolutionized the treatment of hair fall in alopecia, right from the care to the cure segment. This formulation has been named QR678, inspired by the uber new generation ubiquitous presence of the quick response QR code. 678 in Morse code signifies that there is no answer. Hence, the formulation has been named the QR678 to signify a quick response to a disease which earlier had no answer. My friends, the QR678 therapy arrests hair fall and increases the thickness, number, and density of existing hair follicles, leading to greater coverage in hair loss. The polypeptides used in these formulations are unique, are targeted and focused for hair regrowth and hair rejuvenation on the scalp. And it makes the entirety look very natural, and it is a factor-based treatment. These polypeptides, which have been identified innately, penetrate deep into the scalp and provide nourishment to the scalp, which results in the hair regrowth. Now, unlike other treatments, the over-the-counter products that are available, the QR678 is completely devoid of any kind of side effects. Safety and efficacy studies prove so. Hence, the QR678 has proudly received FDA approval in multiple countries for manufacturing and sale by being the most effective therapy for hair regrowth. And not just that, it has a dual patent both in USA and India. And it has a robust scientific backing of around 12 plus clinical papers, all published in top-notch international scientific indexed journals, journals of repute, journals which are considered as the holy grail by top-notch clinicians, dermatologists, cosmetologists all across the globe. All of this making it a unique evidence-based and evidence-backed product. Now, we are very happy because we are at the cusp of a very exciting era, having treated over 1 lakh plus patients globally and partnered with top clinicians across 10 plus countries who believe in this product, and the predictable results stand as a testimony to the many, many success stories to come. I take this opportunity to thank all of our eminent speakers who are stalwarts in their own fields and rights, and welcome you all to yet another coveted scientific deliberation on the QR678 expert talks at the GCS meet. So guys, sit back, brace yourselves, enjoy, and of course, get inspired.
Hello, everyone. Good day to all of you. I am Dr. Arundha Abrol, consultant dermatologist at the Aesthetic Clinics in Mumbai. I think without much ado, we'll move on to our first speaker for the evening and get the show started. So the first talk today is by Dr. Rinki Kapoor, who is the director and co-founder of the Aesthetic Clinics in Mumbai, India. She has credentials and accreditations from the topmost institutions in the world and years of experience under her belt, which make her amongst the most sought after dermatologists in Mumbai. She's going to be speaking today on the topic QR678 versus PRP. Over to you, ma'am.
Yeah, hi everybody. Welcome and nice to see you all. Hi friends, happy to be back at Hair Talks today. And I think many of us have used PRP to treat alopecia, and many of you have started using the QR678, which I think is the next revolution in medical hair care. So let's see how the two compare. I am the inventor of the QR678 Neo, which has United States and Indian patents and is FDA approved in many countries. Now, PRP or platelet-rich plasma is prepared from the patient's blood. The activated platelets supposedly release growth factors which stimulate hair growth. The QR678 is a ready-made composition in a vial which has specific hair growth factors in optimal concentration selected through extensive research. How how do the two therapies compare is what is important for me as a clinician, and that's why there is this study that has come up. This is from the aesthetic clinics, published in the Journal of Cosmetic Dermatology in 2020, wherein 50 male patients with AGA segregated randomly into group A and group B, first group treated with QR and the next group with the PRP, and let's see the results. So the hair fall is much better and faster controlled by the QR678. The objective analysis shows much better improvement in terminal hair density and shaft diameter in the QR group. The global assessment reiterates these results, and patient satisfaction scores are much higher in the QR678 group. Of course, the adverse events are much higher. As you can see, the red bar diagram here with the red bars, it's the PRP group has higher incidence of adverse events. So this study proves that the QR678 therapy is 3 times more effective than the PRP in treatment of male AGA without remarkable adverse effects. Now let's see what is it that's causing the difference. If you read literature that's available with the PRP, you will see that all studies have a different protocol. All studies use different techniques and protocols. So there's a huge lack of standardization in terms of devices used, protocols for preparing the PRP, frequency of applications, amount to be injected, etc., etc. In fact, if you read this online review in Dermatology Online Journal, which was published in 2018, it mentions that a widely accepted definition of PRP is still not there. So we still do not know what is the ideal concentration of platelets that is needed for optimal hair growth. There is no standardization, as I mentioned, in the preparation of PRP, in the method of injections, the duration between injections, etc. Each one is doing their own protocol, and that's why there is a huge difference in clinical outcomes in different studies. In fact, there is a lot of inter-patient and intra-patient variation among studies. Now, inter-patient variation means if I do PRP today in myself and in you, the qualitatively and quantitatively platelets are different in both of us. So the growth factors they release are going to be different qualitatively and quantitatively, and so will be the results. Similarly, in the same patient, the treatment, if they do in January, then they do it in February, and they do it in March, the concentration of platelets is going to be different every single time. So that's one of the biggest problems with the PRP. Second, it's a long procedure, cumbersome procedure. Patients are traveling an hour to come to your clinic, then they sit in the clinic for another hour for the therapy, and then they go back, it takes another hour. So it takes a lot of time of patients, it will affect patient compliance eventually. Similarly, for physicians, it's time consuming. So had you had a therapy that you can do like 5 patients in 1 hour, it would have been much more effective time wise and economy wise, right? Similarly, PRP also causes hair loss increase in some patients. I'm going to tell you how that happens. The cost of treatment is high, so there's investment involved. So you have centrifuge machines, you have staff, you have sterilization, this and that, increase the cost of therapy. PRP, I think, is a jack of all trades, master of none. It's a non-specific therapy being injected by physicians in any tissue of the body, and they suppose that you'll get miracles. I don't know how that'll happen. Last but not the least, it's not an FDA-approved therapy yet for hair growth, despite being around for so many years, right? So this is why some patients get increase in hair loss. The TGF beta, one of the important growth factors in PRP, has now been found to cause miniaturization of hair shaft. Epidermal growth factor, another important growth factor, has now been found to be a biological switch. So in some phases of the hair cycle, it stimulates, some phases of the hair cycle, it inhibits hair growth. So how can you have, in a therapy that's supposed to cause hair growth, how can you have a controversial growth factor, right? So now you have the QR678. It's a non-surgical therapy, better results than existing modalities and plant-derived. So it's got zero side effects. It's something that's been researched over a long period of time with animal trials, human studies, as well as studies in many different types of alopecia published before it got into clinical use. This is what the QR678 is. It's multiple growth factors, specific growth factors in the right concentration. Every bottle of the QR has a standard amount of growth factors. So every patient, every single time is getting the same concentration of growth factors. This is how it works. It strengthens the hair shaft. You see the yellow blocks there, these are DHT receptors. It has local inhibitory action on DHT receptors. It stimulates blood supply or angiogenesis. It stimulates the hair bulb to produce new hair growth, and it prolongs the anagen phase. Also, it is an anti-inflammatory. Alopecia, we all know now, is a chronic inflammatory disease, and any treatment that you do to treat alopecia, you have to have an anti-inflammatory effect, otherwise it's not going to be efficacious. So these are some of the studies published in literature. Everything is available on PubMed. The animal studies, the human studies, effects in alopecia areata, post COVID hair loss, post transplant hair loss, and female pattern, male pattern hair loss, etc. is all published literature with the QR678. All results that you can see, marvelous results in different types of alopecia. And this is the gist of the presentation. So the QR678 is a standardized therapy. It's a standard protocol, a standard preparation, robust clinical data available on safety and efficacy. It's 3 times more effective than the PRP. It's a targeted therapy just for hair growth. It's got beneficial results in all sorts of alopecia. It's easy and quick to use. In fact, you can do like 6 patients in 1 hour span of time. There are no inhibitory growth factors, no investment in devices, is not a biohazard, and there are no side effects. It's also a patented and FDA approved therapy, which in itself means that it's safe for human use. So this is something that I wanted to show you, which will reiterate what I have mentioned.
Hey,
Please
I
listen.
heard vitamin C serum is really good for the skin. Let's get some fresh vitamin C extracted from oranges.
What? Why? Are you okay? Vitamin C containing serum is so readily available and from some of the top companies.
Well, I just wanted it fresh.
So, all serums contain fresh vitamins?
Why are you so shocked? Weren't you going to get that PRP treatment for your hair? And didn't you tell me PRP contains stem cells and growth factors for your hair growth? Doesn't PRP involve taking your own blood and preparing growth factors from it?
Yes. So,
You know, they take out your blood and extract hair growth factors from it before they inject it in your scalp, right? You know this wastes a lot of time and is painful too. Why can't they just inject the hair growth factors directly? Isn't it like extracting vitamin C from oranges instead of using a ready-made and standardized skincare serum containing vitamin C?
oh, I never thought of it that way.
Do you know there are 6 growth factors in QR678 hair growth treatment? Do you know these are prepared with latest technology? Do you know QR678 has been proven to be 300% more effective than PRP? Then why do you want to get your own blood drawn out just to prepare PRP for your hair growth?
Yeah, so I think that's what summarizes it. So, as modern physicians, I think we must analyze whether we want to continue with the old horse or we want to get on to newer technology, which is the car, right? So, thank you so much for your patient listening.
Thank you so much, ma'am, for that wonderful talk. Our next speaker for today is Dr. Neha Sachdev. She's the founder and managing director of the Metamorphosis Clinic for Hair and Skin. She holds extensive experience in the field of aesthetic medicine and is a well-known aesthetic expert in Mumbai and Delhi. She specializes in non-surgical face and body contouring, beauty care, laser removal of tattoos and injectables. She was also awarded as one of the young women entrepreneurs to have a successful chain of clinics in Mumbai and Delhi. She's going to be speaking to us today about the use of QR678 in telogen effluvium.
Thank you so much, Dr. Arundha. A very good evening to all the lovely panelists, the entire team of QR678, Dr. Rinki, Dr. Debraj, and everybody watching this today. So I'm Dr. Neha Sachdev, and my topic for today is QR678 in telogen effluvium. As we all know, the hair growth is orchestrated in 3 phases, anagen, catagen, and telogen. At one time, about 90 to 95% hair are in the anagen phase, and about 5 to 10% hair are in the telogen phase. Telogen effluvium occurs when more than 3 times hair are in the telogen phase at one time. Even when we just tuck the hair a little, about 3-4 hair just come out. Telogen hair are hair that typically fallout of scalp at the end of telogen. They accumulate in our brushes and our combs. They flow down the sink and drains. These hair are usually bland looking and club shaped. They often have oil and debris stuck onto them. Telogen effluvium largely affects women, and the most common causes are nutritional deficiencies, childbirth, post illness like typhoid, post COVID, poor lifestyle like chain smoking or erratic sleep, post a major surgery, hormonal imbalances, physical stress or prolonged stress, toxic chemical based hair color usage. So from here on, I'm going to be discussing some cases of telogen effluvium that we've seen at Metamorphosis. So this is a female patient. She was about 45 years old when she started the treatment. We did 6 sessions of QR678 for her, spaced at 3 weeks interval, and these are the results that we got. She was very happy with the treatment, and she saw some significant changes in the results as well. Another female patient, age 41, she had, this was post COVID that she had this hair fall. It was very major. She had a lot of thinning areas, a lot of gaps. Here, about 8 sessions of QR678 were done. So about 4 sessions were done at 3 weeks interval, and then the next 4 sessions were done at about monthly intervals. And here also we saw some substantial results. So basically, the sooner you address the symptoms of hair loss, the more likely you are to be able to prevent the irreversible damage. This is another patient, male patient, age 38. So here we had already done 3 sessions of GFC PRP treatment before we had introduced QR678 at our clinic. And then we followed up the GFC with 5 sessions of QR678 for this patient. And we saw some fantastic results. The photo on the top left is the before and the bottom right is the after. And you can see there has been some significant changes with completely a non-surgical treatment. So this one is the most substantial of all. Female patient, lawyer by profession, 38 years, stressful job. She was losing tons of hair. So here, 6 sessions of GFC is what we had started, and QR678 was introduced later on to her protocol, as that's when we started it at the clinic. And so 6 sessions were done at 3 weeks interval, and this is the results that we achieved with this patient. And it was life-changing for her. Even the results are very beautiful. It made a massive difference. It made a massive difference in her life. Another female patient, age 33, she's been doing a lot of chemical treatments onto her hair. So this is after 6 sessions of QR678 done at 3 weeks interval. We saw some substantial results here as well. Female patient, 39 years of age, 6 sessions of QR678 done. She was also suffering from telogen effluvium, and we could achieve some significant results in about 6 sessions for her. So I would like to highlight the points of using QR at our clinic. There has been no pain or discomfort reported by the patients. The treatment is super fast. It takes only 1 ml for the entire treatment to take place. So it's very fast. So it's good for us as doctors as well as the patient. It has very easy acceptance with the patients, especially with millennial patients. They love it. The procedure is simple. There's no hassle, not time consuming, no blood withdrawing. So it is much more hassle free as compared to a PRP treatment. It is ideal for patients with hair fall, who need hair regrowth, who've been seeing some volume loss. It is also very good as a preventative treatment. For someone who's coming in for a laser treatment or a peel treatment, and they need to just start addressing as a maintenance treatment, a prevention, something for prevention for their hair. So this is a very good treatment to start, and we advise this at our clinic. I would like to summarize by saying we see substantial results as early as 3 sessions at our clinic. We see hair growth, 5 session onwards, we've seen some hair growth to start. And we've been using QR678 for about 2 years now, and we've been seeing satisfactory results. Thank you so much for giving me this opportunity of coming here today and being able to present these pictures and slides to you. Over to some patient testimonials now.
Hi, this is Madhuri. I'm an existing customer with Metamorphosis. I have been taking their skin treatment since few years. Post-COVID, I was facing a lot of hair fall issues, and my treating doctor at Metamorphosis, he suggested me QR678 injections. and I could see results in just 3 sessions. It has really helped me a lot, and I'm really happy about the treatment, and I'm looking forward for my remaining sessions. Thank you.
Hi, my name is Mustafa and I am a patient of Metamorphosis. I have been taking their skin treatment for quite some time. Recently, I was facing an issue in terms of my hair fall and hair thinning, which I wanted to address ASAP. So I met the doctors from Metamorphosis. They suggested me a treatment by the name QR678. I have taken so far 6 sessions and have seen visible improvements in my hair fall and hair thinning. And I hope that this improvement will continue as I complete all my sessions.
Thank you so much, Dr. Neha. That was a great talk. So we do have the panel discussion at the end, but we came up with a relevant question that was asked by one of the speakers. Dr. Bhairav Gokti from Ahmedabad has a question for you, Dr. Neha. So they want to ask, what is the logic of using GFC with the QR678? Do they work in different ways, or are you using the same only because it's more expensive, the QR, than the GFC? What would you have to say to that, Dr. Neha?
Yeah. Hi. So the patient that I've shown in the pictures, we had already done GFC beforehand, and then the QR was introduced at the clinic. So it was we had not used it together. So GFC was completed, and then the QR was added on to the treatment.
All right. Okay. Thank you, ma'am. So we'll carry forward with more questions at the end. For now, we'll move on to our next speaker for today, Dr. Simal Soin. She's a respected name in the field of aesthetics and cosmetic dermatology internationally. She has a large team of very bright and experienced doctors and therapists who work with her, and is recognized as one of the key opinion leaders in cosmetic dermatology by clients and media alike. The Aina Clinics is her brainchild, and it combines the cosmetic dermatology, clinical dermat, hair loss solutions, anti-aging, weight management, etc. Everything under one roof. She's going to be speaking to us today about her experience of using the QR678 at Aina. Ma'am, over to you.
Hello, good evening. It's a great pleasure to be here. I just want to say that I am just setting my screen. I've called the QR678 the numero uno hair saver of our times. We've talked a lot about, the polypeptides and what goes into it. I won't go into that, but I thought that I should make this little slide. And about Aina Clinics, our QR678 history. We started it in the May of 2020. Is my screen okay? Is it visible?
Yes, ma'am. I'm requesting you to make it
slide. Yeah. So we started it in the May of 2020, soon after the first lockdown. So 208 patients, 755 treatments to date. Male-female ratio is 1:7, and I think it's less possibly because we don't do hair transplants in clinic. And 10 doctors doing treatments at our clinics. So our protocols for QR678 treatment are, and I must add before I start that I was one of the first people to start using QR678 in India, and I don't let Debraj forget that. So, so our protocols are, we give it standalone for telogen effluvium and female pattern hair loss, and we give it in combination with PRP for male pattern androgenetic alopecia and non-responders to the first, which has really not been any. Along with that, we combine an oral hair supplement, a vitamin supplement, and topical cosmeceuticals. And no minoxidil or finasteride is given to anyone. And in fact, out of the 208 patients, nobody was on finasteride. And in fact, we tend to wean off people from minoxidil a lot of times that they're okay to do that. So indications: men for male pattern baldness, women female pattern hair loss, acute telogen effluvium, chronic telogen effluvium, limp lifeless hair, and hair weakened by chemical treatments. So our standalone QR678 success has been extraordinary, in fact, in acute telogen effluvium, chronic telogen effluvium, and female pattern hair loss. So significant clinical outcomes that we've seen is hair fall control, reduced breakages, improved hair strength, and improved density. So when we interpreted the results on dermographic examinations after 4 sessions, we've seen that 85% patients had a decrease in the number of vellus hair, 80% had an increase in the number of terminal hair, and 60% had an increase in the width of their hairs. 80% had significant reduction in hair loss. So what we found is that we were giving QR678 alone, but we do combine some PRP sessions for male pattern baldness. So I'm going to be talking about the results later, but I thought it was important for me that 10 of us doing doctors in clinics and the feedbacks from doctors at INA are important. And so I've put in a little bit of thing from everybody. I actually asked them on our doctors group to send me, feedbacks about QR678, and they'd written such long answers, I had to shorten them. So work like magic in telogen effluvium following COVID. So I'm just going to highlight some points here so Dr. Anupama said, quick, painless, fuss-free, improves hair health as well as stops hair fall. It's revolutionized the hair loss treatment. And she's even said that, everybody had a full lustrous head of hair. Dr. Nandita also said, virtually painless protocol has helped in managing patients with needle pain phobia. Hassle-free, said Dr. Neeti. Dr. Madlika said that it boosted the confidence in a lot of people because they were very emotionally down with the kind of hair fall that they've experienced for years. Then Dr. Komal talked about common hair concerns and what we're giving it for and how what the response was after 2 to 3 sessions, what it was after 4 to 6 sessions, and only in male pattern baldness is where we did give PRP sometimes. So Dr. Pratisha talked about marked improvement in hair density and girth of existing hair, supportive treatment in alarming hair loss, high patient tolerance and compliance due to ease of administration, good option for people with fear of needles. People do not experience any heaviness or headache, which may be there after PRP. And here I must add that although it's made obviously life simpler in general for patients who come to us, but even for the doctors to get away from having to draw blood, and then although all of our doctors are now quite deft at it, but it's just so much more complex. Then the edge over PRP, less painful, of course, shorter duration of procedure, better efficacy than PRP for telogen effluvium and female pattern baldness, ease of treatment for patient and injector both. And of course, there's a standardized treatment protocol here. This is a features of the female pattern hair loss and chronic telogen effluvium. We know about all of them, but I just put them in there. So I didn't get any patient testimonials because I will let the results speak for themselves. And although I have to say that I still feel, I've always felt a photography needs, has so much more, could be so much better. But even then, look at our results. So this is after 4 sessions, QR678. So most of them are between 3 to 8 sessions, the results that you see. This is again after 4 sessions. Sorry, after 4 sessions. I have a lot of pictures, so I'm just going to run through them very quickly. After 4 sessions, very extraordinary results. Before, after, these are all only QR678. Usually between 3 to 8 sessions. I haven't mentioned the number of sessions. There were a lot of people here, so. This is after 3 sessions. This is some results with PRP and QR678. So I'm going to even show you those. But here I have to say the QR67 sessions were usually, so we just added them. I'm just going to talk about this one. So usually the QR678 were about 6 of them and 2 PRPs. I love these results. I think they're just so quite amazing. Even alopecia areata here. And I love this gentleman who came in earlier, and at the end of the third session, if you see, he has a head full of hair. So this is a dermoscopy image after 4 sessions that we did try to put together. So these are pictures courtesy doctors at Aina Mehroli and Aina Khan Market. And I want to say that this is something I put together about how emotionally upsetting and distressing hair fall can be. And so the results are conclusive, the hair growth formula works, and now we just need to sort out the dosage. So why it lives up to its name? It's quick, it's painless, it's hassle-free, it's a great first-line treatment, no non-responders, builds confidence, no side effects at all. I didn't even think to mention it. Takes away hair fall associated stress. That's the other thing we noticed when people came in very upset and you gave them 2 of these sessions, or even 1 session, they just felt so much better, and it got them out of that emotional stress, or which actually makes hair fall worse, I believe. Good for all age groups, predictable results after 4 sessions completely. Standardization is the key, and does away with blood draw and needle phobia. And I also truly believe that anything that is good will always pick up. So I was just talking to Debraj, and I realized that we were one of the first people to start it, and he said it's being done in 500 clinics now worldwide. So that's pretty amazing. Kudos and much gratitude to the QR678 team.
Thanks to you as well, ma'am, for sharing such a wonderful presentation with her. I think some of the before afters that you have shared with us just speak for themselves. Although I did notice, so you've mentioned using PRP with the QR in some cases. So do you recommend that, and when? No. I mean, in which any particular cases?
So I think only with people, and I have to say honestly, we did combine them sometimes with people with male pattern baldness, only male pattern baldness, not female pattern baldness, not telogen effluvium, and that too not all the cases. If you saw, the first few were only with QR678, but we did add, and it was mostly in a ratio of about 6 QR678 and 2 PRPs. I think somewhere psychologically, sometimes people felt, and even the doctors felt, that people liked the whole idea of, they felt that it was a much more evolved process. They'd heard of PRPs. So that's one thing. And only male pattern baldness. So we've only added them. That was the later bits. So these are also, sometimes people had them earlier, and then we added the QR678 to the continue. So, but I think it's been an amazing addition to the armamentarium of aesthetic procedures that we have now. I mean, India, of course, but worldwide. It's something that we were looking forward to. And thank you so much.
Thank you, ma'am. So we move on to our next talk for the evening. Dr. Deepa Prabhu. She's going to be speaking to us today about the use of QR678 in South African patients. Dr. Deepa Prabhu has been practicing aesthetic medicine for the past 11 years in Johannesburg, South Africa. She is an ex-co member of the Aesthetic and Anti-Aging Medicine Society of South Africa, and is also a local trainer for MERS Aesthetics and Reddy's. She's a key opinion leader for the QR in South Africa. Ma'am, over to you, please.
Good evening, dear colleagues and fellow faculty. I am honored to be presenting as part of the Hair Talks for July 2022. I am Dr. Deepa Prabhu. I am based in South Africa, Johannesburg, and I am going to be speaking about my experience with QR. We're going to get right into it. I'm going to start my screen sharing mode. There we go. QR678, when I was introduced to it, I was very excited to be offering this to our patients. Just a little bit about myself. I am an aesthetic GP in private practice for the past 11 years. I am based in Bryanston, Johannesburg, South Africa. My focus is primarily injectables and non-invasive aesthetic treatments. I was introduced to QR during 2020. And then the COVID pandemic hit, and there were a lot of challenges with regards to getting QR here. We currently have QR, and I am very excited to be able to offer this unique FDA-approved treatment to my patients. We have started treating quite a few patients, but we're looking at increasing the number of patients. A little bit on alopecia in South Africa. It is a common complaint in private aesthetic practice. However, in my practice, I find it is not a presenting complaint, so history taking is essential. In the variety of patients that we see in the practice, the ethnic African patients traditionally complain of traction alopecia. That is generally from the weaving, the hair braiding, using relaxers, harsh chemicals being applied onto the scalp that causes the hair to be fragile and often breaking. So that is what they present with. In Caucasian patients, it is usually due to stress, post-chemotherapy, drug effects, chronic medical conditions. In Indian patients, a lot of patients are anemic. They have thyroid problems, hypothyroidism, untreated or subclinical hypothyroidism, as well as autoimmune conditions like polycystic ovary syndrome. Overall, we have noticed post-COVID prevalence have definitely increased in South Africa, and I'm sure that is the case globally. Common treatment options. In South Africa, we have specific hair clinics dedicated to alopecia. So in private aesthetic practices, we do not see a lot of alopecia patients. So what I assume would be in a hair clinic, PRP, would be 90% of patients would be treated. There are some laser treatments and laser caps that are available that South African clinics do advocate to use. We also have various injectables on the market in South Africa, ranging from hair filler to the NCTF cocktail to mesoaesthetic. They are all injected in a mesotherapy form. So why QR678? There have been 100,000 patients treated with QR globally. It is safe, it is effective, it is reliable, the ease of procedure, it is affordable, there is minimal to no complications or side effects. It's backed by science, and of course it is FDA, US, and India patent. Adjunctive treatments in the practice. What I often advocate is patients must be on a medical grade collagen supplement. We advocate daily minoxidil solution, sometimes twice a day, ranging from 5% to 7%. We also do a lot of NAD, nicotinamide adenine dinucleotide supplementation, and IV therapy, especially if immune system is compromised. This is just a quick video of demonstration with a 30 gauge insulin BD microfine syringe. We sometimes microneedle it in depending on patients' needs. Thereafter, we do post-treatment with LED light with the red light to ensure optimum collagen stimulation and to calm those hair follicles after we have injected. We also apply stem cell serum, which is soothing and calming to the scalp. Patient education is vital. Realistic expectations of patients are very important in goal setting. We also need to advocate that patients need to be compliant with their treatments, they need to be dedicated, and they need to follow through with their appointments. Healthy hair care practices, holistic hair care routines are very, very important. Just basics of hair education, and then also the choice of hair extensions or hair weaves are important. We're going to move on to case studies. My first patient is a 61-year-old female complaining of alopecia, diffuse alopecia. This started in August 2021. Supplements, she was on multivitamins, Ayurvedic Brahmi, and she was on saw palmetto. Her bloods reflected subclinical hypothyroidism. She opted not to treat it. It was not overt hypothyroidism. Her TSH was 2.5, her T4 13. Ferritin was a little bit high, so that is indicative of inflammation. Her hemoglobin was 13.4. She had 8 mesotherapy sessions from the period of August 2021 to December 2021 with minimal results. The patient was relatively unimpressed, and then we introduced QR. So her first QR session was in February 2022. Currently, she has completed 5 sessions of QR678. We have done a combination treatment for her. We started with multipuncture techniques with 30 gauge 8 millimeter insulin BD microfine syringes, focusing on the areas of hair loss. Thereafter, the next session, we alternated with dermapen microneedling, the depth ranging from 0.5 millimeters, mostly 1 millimeters, to see that scalp erythema, and there was no additional medication or collagen supplementation. These were her results. So very, very nice, impressive 3 to 4 millimeter hair growth in that area on the temples. And there is a short video. I won't play the whole video. This patient was one of our first QR patients that we have treated. And you can see here all of the baby hair growth. So these tiny, tiny hairs, these are after 5 sessions. And if we part the hair, let's see what we can see. We can see all these baby hair growths, all these gray hairs. You can see here, this is all baby hair growth. And I want to go to the back, to the crown area. Look up for me slightly. You can turn away from me. You can see the presence. This is all new growth. Look at all of this hair growth there. The short hair here. So that was that patient, and she was very happy with the results. We will continue for the next 4 sessions with her treatments and looking forward to posting her results. The next case study we're going to move on is a male patient, a 47-year-old male, presenting with androgenic alopecia, Norwood scale 3. He had a history of completing 6 PRP sessions during 2021. They had also prescribed the 5% minoxidil solution. There was minimal improvement in the density of hair. There was no chronic medical conditions or medication that he was taking. All of his bloods were normal. We initiated his first QR session in May 2022. He has currently completed 3 sessions, and recently we have prescribed dutasteride for him. This is a quick video of the treatments, just the multipuncture injections. We have not done the needling as yet. And these are really phenomenal results just in 2 sessions. So you can see on the left, scalp health looks very, very good, not so red, no erythema. In the middle, you can see on the temple area, the hair looks fuller, the hair quality looks better. The hair health looks better, it looks softer. And in the last picture on the right posteriorly, you can see hair health look better and slight rejuvenation of that hair. Those were the case studies. The future of QR678 in South Africa, I feel this is just the beginning. It is really an exciting time where we can offer patients a product that works at an affordable price. And especially post-COVID, I think a lot more patients will be seeking treatment for alopecia. Thank you for listening, and I am looking forward to sharing more results during my next Hair Talk meeting. And if you have any questions, you're more than welcome to ask faculty, and they will be sure to help you. Thank you once again. I was honored to be a part of this Hair Talk. Bye.
Thank you so much, ma'am, for your wonderful insights. So Dr. Bhairavi unfortunately could not join us today. We'll move on straight to the panel discussion. We've got quite a lot of questions from the audience. Dr. Simil Soin, there's a question for you. So do hair dyes harm the hair, and what can we do to prevent the damage by the hair dyes, and can QR678 be used along with the dyes or to treat the side effects by that?
I mean, hair dyes, anything that you use is chemical. So we all can't live without our hair dyes, of course, but it's nice to be able to nourish the scalp. So I also treat it as anything to nourish the scalp. It of course can be used with anything, with hair dyes from 19 to 70 to 80 years of age. It's perfectly fine to use it. Anything chemical will impact the scalp in some way or the other, like you said about hair dyes, coloring treatments, hair dye treatments, anything which is paraphenyl diamine. We're even moving towards more natural hair colors now. But I have to say that, I mean, we will still continue to do them. So it's a good idea to be able to nourish your hair with QR678. Use it for everything.
Okay.
Even people who come, even people who come for a hair wash or something, and they have, people who are scared of needles or anything. It's just such a simple treatment.
Yeah, we do get quite a lot of patients who just cannot live without their dyes, and yet they want something to limit the damage caused by it. So yeah. There's another question for you, ma'am, by Dr. Sneha from Delhi. Has asked, can you use QR while planning for pregnancy or while you are pregnant?
I would have to say no. I would have to say anything's a no. No in pregnancy. Even if you know it's safe, it's fine, it's okay. But anything injectable would be a no-no. I'm sure Debraj would attest to that also, right?
Absolutely. I think that's absolutely right. I mean, we should never forget that the Hippocrates Oath puts us under, we have to first think of doing no harm, primum non nocere, as it's called. And since we don't know enough, these are biomimetic peptides. I don't think there'll be any harm of using PRP or these, but I don't think there's any good reason to use anything in someone who's undergoing pregnancy or undergoing lactation. Not to forget that there was a US FDA approved product called thalidomide, which led to this unbelievable thing called phocomelia, in which children were born without limbs in the US. And it's not something that any of us need. So I think in pregnancy and lactation, it's best to just keep quiet, and especially if the poor child, unborn child, has no decision-making prowess at that point. So let's keep him or her out of that entire ambit.
And thalidomide was given for hyperemesis.
Absolutely. Yes, absolutely.
So I think anything, even for laser hair reduction, it's not going to do any harm, nothing. But it's just also you can't predict the results. So
Absolutely.
you don't know what's going to happen really.
Even if there's a 1% risk, I think even surgeries sometimes, even cosmetic surgeries, we try to avoid in people who are pregnant. You don't know enough. You may do it under local, but my question is very simple. I mean, it will take 9 months of pregnancy. Why not do all of this after the 9 months? What's the hurry at this moment in time? So I would also err on the side of caution. I wouldn't do any procedure in someone who's known and she's pregnant and she's lactating. I would definitely not do it.
So, but while planning for pregnancy, you would say it's safe to use?
So while planning,
that was actually the question I was asked.
While planning for pregnancy is a very debatable question. Planning for pregnancy could be, you're planning for pregnancy in the next 6 months, or you're planning immediately. If you're undergoing IVF, we don't do it. No, because if you're undergoing IVF and you're thinking that you'll have a cycle which you'll miss and you'll be in the middle, we don't do it. And especially, it's also not appropriate because there will be hormonal changes once the woman undergoes pregnancy in any case, right? I mean, the dermatologists of the group, including yourself, will know more about this. I should be the last person to speak on it. But I'm presuming that in any case, possibly with all the stuff which is happening in the female body, it's just the treatment itself becomes very unpredictable. And that's also one reason I would stay away from it, I think.
And I also want to say that after now that, we've done the 8 sessions and we've got almost everybody who goes on to a maintenance, because, then they have 8 sessions once a month and then it's easy. It works well. They're, the results are so good that they go on to maintenance. They'll come and do it once in 2 months when they know that there's no harm. And another thing that I find is very useful for us with people who are very scanty, like a young 24-year-old came to me, very thin, scanty hair. I mean, I think that, even those things for which you couldn't do much, you have no solutions except finasteride and minoxidil. It's really a great solution for all of that. It's really helped a lot of the hair issues that we've had to, decontent with without anything, useful being available to us before this.
Definitely, I would agree. Dr. Swain, another thing I wanted to ask you personally was, so you have been listed as one of the first users of the QR. How do you feel it is as a revenue driver? I mean, do you find that it generates more revenue as compared to GFC or say PRP?
Oh, absolutely. I mean, absolutely. Because, first of all, even if they've done one session, they're just happy to take any number of sessions, because the PRP is obviously such a loaded treatment, and you're worried about so many issues. You're worried about the side effects, you're worried about anesthesia, you're worried about the blood draw. Sometimes if people are not good at it, then you got to get a phlebotomist to do it. So, just all of those things. But people and in terms of business, yes, of course, it's a good business driver. And I have to say, it's not, people are generally happy to pay for the, treatment if they find that it's easy to do and it's got good results. I find sometimes people will say, I won't take a package. I won't, we give them a better price in a package deal as opposed to a individual session, because they have to have number of sessions for this. So we work out a package deal for them. And I think it's a very good business model to do that.
Dr. Neha, what would be your thoughts on this?
Yeah, so we are charging similar for QR as well as the PRP treatment, but still the QR, I mean, people are, like opting for more sessions of QR, like because obviously the treatment does not involve the blood withdrawal. The treatment is quicker. It's actually a lunchtime procedure. They're in and out in about 5 minutes. So all those factors are making it a very efficient treatment, and the number of procedures that are happening for the QR at the clinic have increased significantly.
It's increased significantly. It does increase. And also the other thing I find with this is people do refer a lot of friends and family for this.
Yes.
They'll never refer for anti-aging, but they're kind enough to refer for hair loss. So
yeah, exactly, that holds true for any hair loss treatments, I would say, not so much for the cosmetic and the injectables, definitely. Dr. Neha, there's a question for you from the audience. Does a patient need different approach in different seasons while using the QR678?
No, we don't have a different approach as per the season for the product, because the product is, I mean, everything is prefixed in the bottle. So you just have to do the same quantity. You have to take out about a ml, you have to inject it 1 centimeter apart. So it's just been the same protocol that we've been following. It's just that the number of sessions vary from patient to patient, depending upon the grade of hair loss, depending upon how bad the telogen effluvium has been. But otherwise, the protocol is pretty standard, and it's actually very easily accepted also by the doctor as well as the patient.
Yeah, I'm sure you'd. Sorry, ma'am.
I also want to say one more thing. Sometimes you have people from overseas, and I really don't want them to give it a try, because there's really nothing, which is an equivalent of this. The West is all about finasteride and minoxidil. So we do give it more often also. Sometimes you can give it because it's completely safe. It's only because it's a protocol to give it once a month. But you can give it if you've got somebody over from overseas and you want to sort of finish a treatment or give them at least 2 or 3 sessions in about two months. We would give it once in 2 weeks also. There's no harm at all. It's very safe.
Okay. Moving on to the next question, Dr. Rinki, there's a question for you by Dr. Aditya from Bangalore. He says QR678 is a recent one. Glad to know more. How effective do you think the QR678 injections are in new hair growth terms? And ideally, what are the protocols to be followed during the session and post sessions?
Yeah, I think a lot of these things have already been spoken, and it's very heartening to see. I mean, of course, we are the inventors of the QR678, but whatever is coming from all the doctors here as part of their experience is what is the real thing, right? So as they've started using it and experiencing, so as Dr. Simil has said that she's also giving it, on a more frequent basis for international patients, and she's also giving it in different protocols. Dr. Neha has also said the same thing. So basically, the thing is that, of course, you can give it. The ideal protocol is once in 3 weeks to once in 4 weeks is the sessions that we do. We do approximately 8 to 10 sessions is what the studies mention, the pilot trials and the RCTs that's what they mention. But like, for example, if you have patients with severe telogen effluvium, right, like post-COVID hair loss or post-pregnancy hair loss, where the patients are just crying and they're coming to you with tufts of hair in the hair and saying you get bald. If you're not treating me, I'll get bald in the next 1 month, right? So if the condition is so severe, we've also done it every 15 days. So we do it once in 2 weeks, until the hair fall arrests. And believe me, just like one of the doctors here mentioned, that it's superbly effective in post-COVID hair loss and acute telogen effluvium. You see the results, the arrest of hair loss within 3 sessions of the QR678. So the protocols are standardized, but they can be tweaked according to the severity of the condition. In fact, in alopecia areata also we've done it like every 2 weeks for patients with severe alopecia areata. So that's how we do. And once the patient gets good results, once the hair growth is significant, then you can just keep the patients on maintenance. There are a lot of patients whom we just keep on hair applications, hair serums or peptide serums or hair supplements as maintenance for a long period of time, of course, with alteration in their lifestyles, if any, and especially PCOS patients, etc. But there are patients also who are so happy with the therapy, and they feel that if they're doing the sessions, the hair looks phenomenally good. So in such patients, once you've done the sessions of the QR678, done with like 8 to 10 sessions, you can also offer them maintenance for once in 2 to 3 months over a long period of time, because it's completely safe. I mean, even if you do it for a lifetime, there's no problem. So these are some of the things that we are currently doing with maintenance with all of this.
In fact,
Arunda,
that I have
sorry, go ahead.
I have a friend, a doctor in America who came and she had 2 sessions here and she couldn't believe the results with that. So she asked me if she could take a few vials back and, get them injected while she was in the US. So.
Yeah. So a lot of patients are taking vials, international patients, no, Simal, especially who cannot come down to India to get it done. They're carrying the vials with them. In fact, we also have a published paper now where they can do it themselves, because injecting for the patients themselves is going to be difficult. So they're also doing it with the derma roller. So there is a technique of doing the QR678 with rollers, for patients who have to do it on themselves, who don't have any support. So that's also a recent publication, and that's also giving very good results.
So I just think that it's very important to be collaborative when you are coming out with anything which is new. It's important to be collaborative. I don't think any of us have all the answers. And I still remember early 2000s when Botox was hitting the Indian market. And Jean Carruthers has been someone who's been a long-standing mentor to my fellowship preceptor. So as a result of which I knew her personally. But Jean had said one thing which really stuck in my mind at that moment in time. And she said, look, we figured out botulinum toxin. We were using it for blepharospasm. We were using it for various other things. And we saw the lines disappearing. But ultimately, as more and more people use it, and each different mind uses it in a different way, all of us learns. I mean, our objective is to further science, and science will get furthered when there are multiple people who are looking at it. So in that sense, we are all co-collaborators, we are all co-inventors of a product, because botulinum toxin may have first been utilized by Jean Carruthers, but the first Indian paper on deciding the protocol for masseter hypertrophy came out of the aesthetic clinics. I mean, so each one of us is contributing in every way, and it's good to listen to everyone's expertise. Plus, we may have experience in a certain part of the world, but other people may have experience in other types of patients, etc. I mean, there's not only one type of people in the world, right? So from that perspective, I think we are all co-collaborators and co-inventors in trying to take science forwards. And it's important for all of us to realize that not to suffer from a confirmation bias. What we may know may not be the gospel truth. Others may actually come up with far greater usages of the same. Sorry, Arunda, sorry to butt in.
No problem at all, sir. So as we were discussing protocols of the QR, there was a question with respect to the protocols. So while using GFC with the QR, can you combine the both in the same session, or do we have to keep the sessions apart? Or if yes, how much interval to be taken between the sessions? Dr. Neha, would you like to take that?
Sure. So we have done some patients together as well with GFC and the QR. We keep a gap of 2 weeks between both of them. Like the patient has to come twice a month at a 15-day interval. And for example, if the GFC is like about 3 sessions of GFC and 6 sessions of QR, so we do like day 1 GFC, day 15 QR, then again after 2 weeks QR, then again another GFC. So GFC is spaced at 1 month interval and QR at about 2 to 3 weeks interval. And once GFC finishes, the 3 sessions of GFC finishes, the QR still goes on.
Debraj, I have a question for you. Do you do any PRP in your clinic at all now?
No, 2014-15 is when we gave up PRP altogether. And Dr. Simal, I personally have been a androgenetic alopecia patient from a very long period of time. And in my family, no male over the age of 25 has hair. I always turn around and say we are all footballs after the age of 25, because it's almost like a field out there and there's no hair whatsoever. So I've been on treatment for a really long period of time. And I reached a stage, the PRP did work in me initially, but then we reached a stage where the PRP stopped working in me. And I always turn around and say that, ultimately, we all know about microneedling on the skin. And if you use a needle on any part of the skin, because of the controlled injury that you're creating, you will have some amount of cytokines being released from the skin itself. That in itself will cause some hair growth, but at some point that needling will stop having its effect. And maybe that's what happened with me. I just stopped reacting to the PRP. And once we stopped reacting to the PRP and then the QR started working, I've been on the QR now for about 8 years plus. So as a result of which, what my belief is that PRP does not really work. And especially after we had the clinical trial where we did two things. First one, we didn't publish, it's data on file. We actually did a split head trial. We did PRP on one side of the head and QR on the other side of the head. And we figured out a fancy way of blinding it so that no one knew whether the PRP was being injected or the QR. You did know because this was slightly yellowish, that was slightly whitish. But you tried to blind it as much as possible for the people. And there was
it would be very painful.
It was very painful.
Exactly.
As well.
I was just thinking that. Yeah.
It was very painful as well. But we did it on 10 patients, and obviously you couldn't do it on patients. So these were all 10 employees / accomplices / other doctors of the aesthetic clinics itself. And then we did the 50 patient trial, which has been published in Cosmetic Dermatology. And after we saw that there was really no comparison. We stopped using the PRP altogether. In our opinion, it also doesn't make very good business sense, simply because to create the PRP, you're also spending a lot of time. I mean, it may be substandard, and also you're spending a lot of time, which is also what we are seeing, because there are a large chain clinics which find that the entire charade of creating the PRP and spending 1 hour on it, if you're a very high turnover clinic, you can go ahead and reduce that. Plus the entire thing of using blood as a supplement and managing body fluids, that in itself, sometimes you don't know whether it causes any other problems also. So those are some of the reasons why we gave up on PRP.
I would have to agree, and I would also want to do that, but I think it's just for a few patients. And sometimes the doctors feel that maybe, especially the male pattern baldness, the most severe varieties, that's where, when they don't want to do transplants, which I know is the option, obviously, and those are the only ones who, we've done it for, or they've already having it before. I find it quite a cumbersome technique, and you're not even sure, there's no standardization, you don't know if there's a result, or if it's just the, the ferocity of the treatment which makes people feel that, oh, maybe it works. With us, we never give it. We only do 6 sessions of the QR, or 8 actually, and then we add PRP. We never add it like somebody asked the question, do you combine it? We don't combine it. We've only added it after 8 sessions ever in people who have severe grades of androgenetic alopecia. Never given as a, if you saw first few pictures, they were only standalone QR.
Only QR.
And India's largest skin clinic chain, and I won't be at liberty to take the name, and I was speaking to their chief dermatologist, and India's largest skin clinic chain also uses PRP. So I wanted to know, as a scientist, not as anything else, what is the logic? So sometimes the logic is, patients have been on the PRP and they've been used to having 8 or 10 syringes being injected into their head. And suddenly you're reducing it to a 1 syringe treatment, which is the QR. And then people are like, oh, I'm paying almost the same amount and you're doing less of stuff for me. So it's also about consumer behavioral change. I mean, I understand that as well. It's a question of consumer behavioral change. It's a question of doctor behavioral change as well. We all live in a world where we have comfort zones that we've got used to. And that's what we are anyways doing. So if that is the way that people would like to use it, I think that's their choice. They are well within their rights to do what they think is appropriate for their patients. But in our opinion, because there's so much variability around the PRP, you don't know if the platelets, even in me, are the same at different times of the day or at different times of the month or at different times of the year. Then how do you really know that the PRP has the same amount of growth factor? So because of all of these variability and lack of predictability, that's the reason that we've given up on it.
No, I think Arundha and Dr. Simal, Dr. Neha. So just wanted to comment on this. Basically, as Dr. Deepa has mentioned, right? Change takes a lot of time. So humans are resistant to change. But as they see changes happening, now we have had a lot of patients now coming in whose relatives have had PRP done, and then they came to us because they have looked up on the internet and they have heard about the QR678, and then they have come. They have done the therapy and they've seen the results for themselves. And then they have gotten back their relatives who had done the PRP earlier to get better results with the QR678. So it's gradually coming there. It's going to take time, but it's gradually coming there because PRP, the time when PRP was introduced, that was probably the only thing that was available apart from a transplant, or probably apart from the mesotherapy solutions that used to be randomly available. And that time it was like, oh, my colleague is using PRP, so I should also be using it, right? Otherwise I'll lag behind. So it was like the herd mentality that every second clinic started using the PRP. But then, and that was also without any scientific validity, any validation, just because the neighboring clinic is offering, you said that I also want to offer it. But now when doctors are seeing the scientific evidence, the experience of other doctors, I think it's gradually changing. And I think just like what y'all have commented, all the doctors who are using it here, I think it's going to take this miraculous therapy forward. That's what we expect.
Things have also, I mean, there have also been patients who have not responded to QR. And Dr. Simal and other members, I want to just say that there have been people who have not responded to QR. I always turn around and say that there will be patients who will respond and there'll be patients who won't respond. The same manure won't work in everyone. Nothing's the nothing.
So just interrupt. They may not respond to the extent that they feel they should have.
Right. Yeah, exactly right. So I'm not saying there'll be zero response, but at the same time, they may not have responded very well. Or what we also see is what we call a plateau. They've done 5 sessions. They've got their anterior hairline, but the vertex is not responding after that. So suppose that ends up happening, what we started realizing is that in some of these patients, if they are clinic-based patients and they are able to take therapy, we've actually got very good results by combining it with minoxidil and finasteride. So if you combine it with minoxidil and finasteride, and there's a paper which has been published about the synergistic effects of using minoxidil and finasteride, because the three work through very different pathways, and so they can help in resistant hair loss to that extent. We've also seen that if you combine certain other things like Redensil and Procapil, and that's another home care serum that we've come out with. This is now getting patented, and so if you combine that with this, that also works well. So it's about taking the 90% results and making it 98%. And we are also in the process collating all the information which is coming in from all users all over the world, figuring out how each one of them is using it, and trying to figure a solution why certain people don't respond as well compared to other people. So that's also something that we are trying to figure out as we go along. And obviously, each one of you will also be able to help all of us move forwards, move science forwards.
Right.
Arunda, over to you.
Okay, moving on to the next question. What are the constituents of the QR678 and how does it differ from the rest of the growth factors? Dr. Rinki, would you like to take that?
Yeah, I think I had already mentioned this, the constituents of the QR678. So it's there for everybody to see. I mean, it's there. If you can go online and check the United States patent website, you'll see the entire composition of the QR678. But basically, it has a certain combination of factors which are in the right concentration. So the thing is that, this was the animal trial that we had done. That was done with 5 different concentrations of growth factors. So whether it's like 1 milligram per liter, or whether it's 0.5 milligram per liter, whether it's 2 milligram per liter of the particular growth factor that's going to give the result. So there were 5 different concentrations, solutions with different concentrations of growth factors they were tested. So, and the one which gave the best result was the one that was selected to get into future production as the QR678. So that is what is important, the right growth factors in the right concentration. If you've seen the presentation that I've made, there was a slide wherein I had shown the different stages of the hair cycle where each growth factor works. Okay. So the principal growth factors are insulin growth factor beta 1, then you have the keratinocyte growth factor, you have copper tripeptide, then you have thymosin beta 4 and other similar growth factors. So each of these growth factors does a specific job. There are some which change the telogen to go into anagen. There are some which help to sustain the anagen for a longer period of time. The copper tripeptide especially is a local DHT blocker. So it blocks the DHT action locally at the hair follicles. That's a very important thing because there are no systemic side effects of this, not doing anything to the systemic DHT receptors. Then you have keratinocyte growth factor, which is something which is really effective in cases, there was some question wherein you have patients who do hair dyes and who do chemical treatments and the hair strands become weak. So that's where the keratinocyte growth factor comes in. It also prevents damage due to pollution, due to stress on the hair, etc., etc. So everything is doing a different job. And to top it all, there is something called as an anti-inflammatory effect, right? So a lot of therapies in hair loss, especially if you see minoxidil or finasteride, they do not have an anti-inflammatory effect. So which the QR678 have, and that's a huge advantage because alopecia now, if you see the current world literature, is a chronic inflammatory disease. So even if you take a biopsy from the scalp of an androgenetic alopecia patient, you'll see a lot of inflammation at the hair bulb and at the hair bulge. So that's where the QR678 targets. So there, it's a combination of different growth factors in the right concentration. So copper tripeptide, if it was 5 milligram per liter, would have given a lesser result than the 10 milligram per liter, which is there currently in the QR678. So that's a huge difference which is there. So that's why we say it's the right concentration of the right growth factors that is present in a ready-to-use formulation. That's what makes all the difference. And I think because it has a patent, so patent is basically a legal document, right? The very fact that the QR678 has a United States patent, it has an Indian patent, and patent is something which is a legal document, right? So it undergoes a huge process. We took almost 5 to 6 years to get the patent approved. That's because there's no solution currently world over that has the same concentration or that has the same components like the QR678. That's why it's got a patent. That's why it's got a United States patent. So that itself makes it stand out from everything else that's available currently with growth factors.
Thank you so much, ma'am. We have another question from the audience. How does the QR678 work with the hair transplant? Can it be used after FUE or FUT? Dr. Shom, maybe you could take that.
Yeah. So the thing to understand is the one thing that I always turn around and say is that the hair transplant, for some reason in India, is thought to be the holy grail of all hair treatment. But hair transplant is a surgery. And the main problem with this particular surgery as a cosmetic surgeon is that there is a limited amount of donor hair at the back of your scalp, right? It's actually not a transplant, it's a misnomer. Because any transplant, like for instance, a bone marrow transplant comes from outside someone's body, a liver transplant, someone else gives it to you. But in a hair transplant, your own hair from the back of your scalp comes to the front of your scalp. So I actually call it a misnomer. I call it a hair translocation surgery. Now in a hair translocation surgery, there are two problems. First problem is the number of hair at the back of your hair are limited, at the back of your scalp are limited. Second problem is when you take the follicles from here, you're taking it with the root. And when you take it with the root and plant it in the front, these hair follicles will not grow here. Most patients don't understand that. So if you take too many out from here, you will actually have a thinning or an alopecia at the back of your scalp, which will show up. Second thing, for the sake of this discussion, let's call this back of my scalp as Kanyakumari, and let's call the front of my scalp as Kashmir. So when you're taking any hair from Kanyakumari to Kashmir, some hair follicles will die. Second problem is when you're taking the hair follicles from Kanyakumari to Kashmir, you will be making incisions in Kashmir that will damage the hair bulbs and the hair roots of the natural hair follicles also here. So we know that if you've done a transplant, regenerative medicine or PRP or QR won't work as well in those scalps because there's a damage and there's scarring which is caused to those particular scalps by virtue of the transplant process itself. So my question is, my humble request to all my surgeon colleagues is, yes, a hair transplant has its own role. And yes, there will be patients whom you will need to consider the transplant in. But no, please don't consider it in a 18 and 20-year-old. Just like if I have a high cholesterol level at age 18 or age 20 or age 25, a bypass surgery is not the first thing that you'll do. Prescribing the statins is what you'll do first. That's the same thing that needs to be used for the hair transplant. We need to understand that it's a surgery, and therefore we need to use it judiciously. Now, with regards to the QR, what the QR can do or the PRP can do or whatever you're using as regenerative medicine can do, if you can grow the hair naturally, person may not need the transplant and may be able to delay the transplant, which is a good thing because the donor hair can then be used in their 40s and 50s and not in their 20s and 30s. And then if you're doing the hair transplant also to support the natural hair, because most people don't understand that transplanted hair from the back of the scalp may not fall because they don't have DHT receptors, but the natural hairline will continue to recede. And therefore, it's always good to use regenerative medicine like PRP or QR to keep that hair on the scalp. And that's why it's a combination therapy, which really works very well. Just like in other aspects of aesthetic medicine, having the surgery and knowing when to use the surgeon makes a surgeon a good surgeon. Arundha, you're on mute.
Yeah, so sorry about that. So another thing that I wanted to discuss was the mental health aspects of associated with the hair loss are of course immense and something that we cannot ignore. So a lot of patients coming to me in my practice do suffer from psychological issues post hair loss. So what can you do to make them feel better? Is there anything that you would like to suggest or opinionate on, Dr. Shoni?
Grow their hair. I think that's the simple thing. I think hair is a major problem. And imagine a peacock without its plumes. I mean, imagine a male peacock without having that rain dance that it does with all those beautiful feathers. And our government and lots of governments around the world tend to think that hair is a very frivolous issue. In fact, because I started my career from Tata Memorial Hospital, many people who are cancer surgeons on the face call me a very frivolous surgeon because I'm now growing hair. But the fact of the matter is, as the quality of life goes up, hair becomes very, very important, especially for, people who've had cancer or for women who have hormonal problems. The fact that they don't have hair tells the whole world about their problem. It is actually like being naked in the sunlight, right? A cancer survivor, does she need to go through the situation where everyone's asking her every day, long after the cancer is gone, what happened to your hair? And she needs to remind and rewind that entire story all over again. So we've had a paper published called Alopecia, the Iceberg Phenomenon, which actually shows that when we did a dipstick survey in 800 plus patients all across the country, we showed that men who have hair fall actually start to have sexual side effects because they are constantly thinking about how their partners will visualize them without hair. Not, of course, everyone may be that sensitive, but there are human beings who are that sensitive. And it is important for us not to trivialize any issue. Whether someone's bothered about hair or not is their own choice. But if they are bothered about hair and it's becoming a mental or a confidence issue, in some sense, what is not on the head is affecting what's inside the head, which is their confidence. I think we have a duty as doctors to take care of that. And that's why one of the things that we are doing is petitioning the government and saying, at least in chemotherapy related hair fall, etc., please stop charging GST on these sort of things, because it's a holistic treatment that we need to look at. And you need to look at PCOS, women with PCOS, seborrheic dermatitis, alopecia areata, all these are diseases. Please go ahead and don't treat them as consumers and charge GST, because it's really unfair on the patient psyche from that perspective.
Very rightly said. Thank you so much. Ma'am, you were saying something?
No, I said really well said. That makes sense.
Yeah. So we did quite have a few questions more, but with respect to the time limitations, I think we'll wind up. But in the end, I'd like to ask Dr. Vaibhav, who's a product manager for the QR, if you could just let us know about what are the future enhancements that you are coming up with for the QR. Product enhancements.
Thank you very much, Dr. Arunda. And at the very outset, I would like to yet again thank all the speakers for sharing their experience with the QR678 at their own setups and kind of getting this innate baby and pitch it against its stalwart competitors, so as we may say. Research innovation has always been a key construct in our product development, and fueling feedback from users and end consumers like you all help us drive this process further. In a similar incident, in the entire sojourn of 2.5 years since we've been experiencing the magnanimity of the QR678 and its results, we got very positive feedback. But yet again, as we all know, that hair or the hair care segment is like a Pandora's box. The more we delve into it, the more complex it can become. And the single most reason for this is because no two patients are the same whilst treating this. Hence, the approach towards this becomes very different, because hair as such, or hair loss or alopecia, is multifactorial in its etiology. So we got to know that reports that certain patients, especially females, were not probably responding, or certain males were not responding, or this targeted and focused treatment, which was there and given as a cyclic thing, once a month or once in 3 weeks, as the standard operating protocol suggests, was not probably giving those desired results. So what we did was we thought of giving some at-home applications, which are also targeted and focused, which have well-researched molecules within it to supplement this particular thing. So what we've come out with is something called as the QR678 product suite. And if I may share a quick image of that for you all to have a ready reference for that, it will be great. So that is what the QR678 product suite looks like. It contains the QR678 Neo solution that we all have been using and we all have been talking and experiencing amazing results with. But also along with that, we have these home care offerings, which are a perfect blend of serum, shampoo, and the nutraceuticals. So these serum, shampoo, and nutraceuticals contain well-researched ingredients, because we wanted this to become a 360-degree product suite, that we don't need to probably go and use the shampoo of this particular company and that. So we wanted to give something that is giving holistic results to our patients. Serum, we know a lot of combinations of Redensil and Procapil, which is an amazing scientifically proven composition. We've added that. All of this is in the entire thing of getting intellectual property and getting evidence, which we present to you, and in the ending to the end user as well. We have the shampoo, which contains caffeine, which becomes an amazing ritual that you can use it in the morning, and these targeted ingredients really do a good job. And the nutraceuticals, which not only contain our regular vitamin B complex and other vitamin complexes, but also have a high grade of ashwagandha, grapeseed extract, and so on and so forth. So all of this kind of making this as a holistic 360-degree approach, which we can give to our patients or our customers to have more predictable results. And in our endeavor of doing this, we have seen that our already really good results, the bar has been even raised further. And the best thing about this is that patients like it. Patients are like, hey, the shampoo is really good, even as a regular daycare thing. So I'm giving it to my brother as well, even though my brother is not having a hair fall issue, but it's the look and feel of it is so good. Apart from this product suite, we are currently in the process of going topical. So we've collaborated with multiple other centers across the country and internationally, and research is going on full throttle to get this particular thing as a more or less invasive treatment modality as a topical formulation for all of you.
Thank you so much, Dr. Weber. I, for one, am really looking forward to having all these products to use in our practice. Let's hope the QR achieves greater heights every day and keeps growing here. So I think we'll wind up with the panel discussion for now, seeing the time, of course. On behalf of the organizing committee, I would like to express my gratitude to all the esteemed delegates of this webinar for their presence and their contribution to make it such a great success. We are most grateful to all of you for taking time out of your Sunday, for being with us this precious evening. It's been a great pleasure. Thank you very much. I would like to also invite Dr. Devraj Shom to kindly say a few words. And
So thank you once again for being at another webinar by the Global Cosmetic Surgery. The next webinar by Global Cosmetic Surgery is going to be held in conjunction and in collaboration with the American Academy of Cosmetic Surgery. And the American Academy of Cosmetic Surgery is the holy grail of cosmetic surgeons all over the world. That is coming up on September 17th and September 18th. So please watch out for that. And that's going to be an amazing event because we are having the AACS involved with the GCS is something which is a matter of great pride. I'll be failing in my duties if I don't go ahead and thank Dr. Harshal Tandale, who's the coordinator for the GCS and who's very painstakingly put the program together. And I'll also be failing in if I don't thank all the delegates from over 12 countries, which is about 500 plus who've signed in for today's meeting. I am very, very grateful to all the faculty who've taken so much time to be here to educate all of us about their experiences in this particular product portfolio. And last but not the least, thanks again to the other director of GCS, Dr. Tanuj Nakra, who's a fantastic facial plastic surgeon from Texas in the US, for joining in and saying hello to everyone. Thanks also to Arundha for organizing the moderation very, very well. Have a great Sunday, guys. And until we meet again, hasta la vista.